We told you yesterday that the coastal region of Georgia was the first in the state to receive COVID-19 doses of the vaccine from Pfizer. So here we have Governor Kemp and Dr. Kathleen Toomey with the Department of Public Health here in Savannah to mark this milestone. And what we're going to witness today is some public health officials, some caregivers that have agreed to get this vaccine publicly in order to convince the public that it is in fact safe to take. So Governor Kemp has just approached the podium. We're going to listen in right now.
Our farmers faced a decrease in demand, threatening their ability to keep food on the table for their own families. Waiters, waitresses, hospitality workers, and many others came very close to losing everything, while parents struggled to care for their children at home, but also figure out how to make ends meet. Thanks to our measured approach to the pandemic, fighting for lives and livelihoods, we've been able to lead the nation in the economic recovery. We've celebrated new job announcements almost weekly, protected our AAA bond rating, and avoided draconian budget cuts this past year. But even as we have navigated the storm, as we well know, the threat of the virus remained. And with cases and hospitalizations now on the rise as we find ourselves going into the holidays, life is anything but back to normal, and we still have a long way to go to defeat this virus. But today, Dr. Toomey and I are thrilled to be here as we take this next step. The work done by the Trump administration in Operation Warp Speed to manufacture and deliver these vaccines has been nothing short of a medical miracle. And I want to thank all of those who were involved in the trials and productions, from private sector partners to local leaders like Dawn Baker and Senator Watson, for helping us get to this moment in a period of time we once thought was impossible. Today, just as we took a phased approach to reopening our state, we begin a phased approach to vaccinating the people of Georgia and winning the fight against COVID-19 once and for all. With that said, I want the people of Georgia to hear me loud and clear. We are not out of the woods yet. The limited amount of Pfizer vaccine doses we've begun to receive will be going to the most vulnerable and those that are on the front lines of fighting COVID-19. That means residents of nursing homes and our healthcare workers for this initial phase. The general public will not be vaccinated for months, so we need everyone to hunker down and continue to follow the 4 things that we've asked to limit the spread. Wear your mask, wash your hands, continue to socially distance when you can, and continue to follow the guidance of public health officials that are outlined in our executive orders. These things are critical to ensuring that we can keep Georgia open and healthy while we work to distribute the vaccine as quickly as possible. I'm very proud of how Georgians have followed these steps, and as I've said from the beginning, no government mandate is going to make this virus go away. But individual Georgians stepping up to the plate have joined ranks with the heroes of this pandemic to slow the spread. And that's what Dr. Toomey and I are asking everyone to continue to do. I know full well that people are very tired of having to deal with this and do these things that we're asking. And I know that everyone wants to get back to normal, and I completely understand that. This year, as you know, has brought us unimaginable hardship, but we literally cannot give up now following this guidance and fighting this virus. We are too close to the finish line to grow weary. If we continue to do these simple things for the next couple of weeks, like wearing your mask, washing your hands, practicing social distancing, and follow the guidance, we will get through this together. This is especially important over the next 2 to 3 weeks as we go into the Christmas holiday season. As soon as we can, following the direction from CDC, we will make the vaccine available to all Georgians, and we will secure a healthier, brighter, and more prosperous future for our great state. Thank you all for being here, and I'll now turn it over to Dr. Toomey.
And Dr. Kathleen Toomey with the Department of Public Health is next to the microphone. You've seen her in all of the briefings so far.
Thank you so much, Governor, for your leadership during this time. It is really a great day for Georgians as we watch some of the first vaccines to be given here in Georgia. For those of us who in public health, in health care, for those of us who worked in long-term care facilities, and for all Georgians who have suffered the consequences of this virus, either themselves, their family, or their friends. You know, we now see a light at the end of the tunnel, and we are so excited to be here to celebrate that and to begin this process. As I begin my remarks, I want to acknowledge Dr. Lawton Davis and Dr. Chris Rustin, who have worked with us diligently throughout this process and who really have been instrumental in helping us define our strategies throughout this pandemic. And so thank you to them for all that you're doing here in Savannah and will continue to do for us and the state. I wanted to just again beg all Georgians to be patient, because even as we are excited about this vaccine campaign, we have relatively few vaccines initially to begin with as we roll the vaccine out in phases. We've identified and chosen to follow ACIP guidelines. This is the immunization practice group that advises CDC, an independent, non-governmental group that uses everything from scientific data to ethical concerns to say who should be vaccinated first, who are the most vulnerable, and so that has guided our decision making in this process rather than some other consideration. And I think that everyone in Georgia can be rest assured that that is the approach we're taking, a scientific and ethical one, but based on the allocation of vaccine, which will be slow initially in coming. 5,850 Pfizer doses, so that's the vaccine made by Pfizer, was delivered to this coastal health district, 1,950 doses to Glynn County, 3,900 doses to Chatham County here in Savannah. And so these were the very first doses that came to our state. And we will be receiving additional vaccine tomorrow and throughout the week, both to healthcare facilities throughout the state, as well as to our other public health departments. Our additional Pfizer allocation was relatively small, and this is a vaccine that requires incredibly complex logistics, including a -90 Fahrenheit freezer and some challenges in moving it from place to place in a special box with dry ice. We will have approximately 84,800 doses and expected for this first phase. And already before I even left Atlanta to get here today, all those doses are already allocated to hospitals and public health facilities across the state. We're also expecting Moderna vaccine, which we hope will be approved as early as the end of this week, both by the FDA and the ACIP, to come next week with almost 174,000 doses. So that vaccine was actually tested here in Georgia. Some of you in the audience were part of those vaccine trials. It doesn't require the same kind of logistical challenges that the Pfizer vaccine does, and so we will be sharing that often with rural facilities and those facilities that don't require larger dosing, as it comes in tranches of 100 vaccine versus almost 1,000 in the Pfizer vaccine. Most long-term care facilities, another priority target for us, will be actually vaccinated by CVS and Walgreens in a special partnership that was developed by the federal government. And we are really grateful for their partnership in this. And they will carry out that work very shortly We signed the agreement today and gave the go-ahead, and they will be moving forward at the end of December or the first part of January. And so we'll be seeing that roll out to 95% of long-term care facilities, initially skilled nursing homes. Reminder that everyone needs 2 doses, not 1, which again makes this both these vaccines, both the Pfizer and Moderna, even more complicated, and requires even more complicated logistics. And we will have already developed reminder systems so that we can remind everyone, and as well as the providers, to bring people back. We have worked diligently, as I want to give a shout out particularly to Dr. Davis and his team, because they got the first doses. They will be able to share as hospitals and other providers here in the community are waiting to get their allocation of vaccine. And that is our role. I mean, we really want to be a leader in this vaccine effort, but also reach out and share the vaccine with other providers, so together we can work and cover the state, all rural as well as urban. Again, when I wrote my remarks yesterday, we had 450 providers. We now have over 600 providers signed up, and so I think as we continue, you'll see that there will be providers that have are very much anxious to be part of this effort, will be working with us throughout the state, in all parts of the state, rural and urban. And again, given the fact that the 2 vaccines have different logistics and different requirements for storage, we will be able to cover all parts of the states very efficiently. As I said, this phase 1A is healthcare personnel, residents of long-term care facilities, and we will, at the completion of that, roll into phase 1B, which will be non-clinical healthcare staff, pharmacy staff, court employees, nuclear plant operators, the essential workers that keep our state going. But we also are making the recommendation that adults over age 65 with multiple health conditions also be considered during this time. And I think that's so important. I mean, although the residents of long-term care facilities are at extremely high risk, and their staff also will be vaccinated, there are many, many people that you know, perhaps even your own relatives and friends, who are themselves at risk, and older adults, and we wanted to include these high-risk elderly also in that phase 2. Phase 1C will be all older adults and adults below the age of 65 with comorbidities, and we'll continue to roll out these staged priorities based on risk and the CDC guidance, which comes from the ACIP. As we continue, as the governor said, to vaccinate, this vaccine doesn't work immediately. It requires the 2 doses to be fully effective at an effectiveness of 95%, which is extraordinary. Truly, as the governor said, a medical miracle. But we have to continue to practice social distancing, wear a mask, wash your hands, follow the guidelines, because we have to continue to bear in mind that not everybody is vaccinated, and we have to have the whole state be part of this effort for it to be effective and for us to stop the pandemic. On that, I want to just mention again that one of our biggest concerns that I think about a lot is how can I convince everyone in the state that this is safe and effective and a good thing to do. And we do have a lack of confidence in some areas of the state. We have a hesitancy to get this vaccine or other vaccines, and we are really going to work hard with Dr. Davis and his team and other partners, both the business community, the faith community, leaders throughout the state as a whole, to assure everybody that this vaccine is safe, effective, and really extremely important to everyone in the state, so we can stop this pandemic now. I think that I've covered a lot of the areas that I wanted to cover, but I also wanted to mention, with the holidays coming up again, bear in mind that we still have increasing rates in the state, and follow our guidelines and continue to take those precautions until we can effectively vaccinate everyone that we can in Georgia. Thank you so much for being here, and thank you for this important celebration of this opportunity to stop this pandemic. Yeah, I think we're going to do the vaccines now.
And those are the remarks from Dr.
Okay,
Kathleen
we'll be
Toomey
doing the
with the Department of Public Health.
For many of us, and I'm looking at Dr. Watson as well, you know, we've talked about a pandemic, we've talked about taking part in a pandemic flu plan, but never thought we would be so fortunate to be leaders in a position when that happened. And I actually told the governor on the way in that it's a privilege for me to be here today, to have been, you know, fighting with him this pandemic from the beginning, but to see the light at the end of the tunnel.
Paying special attention or mention of Dr. Ben Watson, who was on the governor's task force, a local physician and state lawmaker here. Now we're moving on to the next phase of this gathering here today, and that is to, in Dr. Toomey's words, to instill confidence in this vaccine process. So there are 4 healthcare workers who have volunteered to take their first dose of the vaccine publicly. There are Tammy Brown. You might know her from her work with the Coastal Health District here. She's the one who's frequently giving messages to you on TV about public safety, everything from the COVID vaccine to the flu and whatnot. Next to her, we have David Wilson. He's an emergency room nurse with Memorial University Medical Center. And after those 2 are vaccinated, we will have 2 from Candler and St. Joseph's, Kim Raymond and Tara Manning. They will be the next to go. So it looks like they are queuing up for Tammy Brown to go first. We're going to try to get you a better shot of that so we can witness this milestone in the fight against COVID-19, not just in our region, but around the state. As Dr. Toomey mentioned, this will be the first of 2 doses that are necessary with the Pfizer COVID-19 vaccine. She said despite the challenges, logistically and otherwise, that poses, she said the efficacy of this vaccine appears to be 95%, which they consider quite good. I can also tell you that there are 2 folks administering the vaccine from the Chatham County Health Department today. They are Lisa Lynn, who's an RN, and Nancy Toth, who's an RN. You may have heard Dr. Toomey's remarks a short time ago saying that some 600 providers have already signed up to administer this vaccine in the state of Georgia. The Coastal Health District was the first to receive doses in the state. More than 5,000 are here. 3,000 of those are here in Chatham County. The protocol for administering the vaccine, healthcare workers are among the first to go. And they are preparing to give the first dose of vaccine to Tammy Brown. Just like that, Tammy Brown has had her first inoculation for the COVID-19 vaccine made by Pfizer. Next up will be David Wilson, who's an emergency room nurse at Memorial University Medical Center. Earshot may be obstructed a little bit, but now David Wilson has had his first of 2 shots for the COVID-19 vaccine. They're applying the bandage right now. Dr. Toomey did acknowledge earlier that some people in our state have their doubts about the vaccine. Some people have questioned how quickly it was developed and whether they can trust its safety. She wants to assure the public today that safety is not a concern, and she hopes that this display will help drive home that message. It does take several years, typically, to develop a vaccine. The difference in this case is that agencies like the FDA were able to focus more and expedite this process to cut out some of the time in between. That's according to officials here. Now we have our next 2 volunteers in the chairs. Kim Raymond, an intensive care unit RN at Candler, and Tara Manning, who's an RN resource coordinator at St. Joseph's Hospital. Somewhat hard to tell with masks on everyone in attendance here today, but I do believe I see Savannah Mayor Van Johnson in attendance and Congressman Buddy Carter. There's news media from all over the state of Georgia here today. They do expect doses to arrive in the metro Atlanta area later this week. So we told you earlier that the Coastal Health District of Georgia was the first in the state to receive doses, more than 5,000 doses. Of course, we told you 3,000 of those are here in Chatham County, but the Coastal Health District stretches all the way down to Glynn County, and we understand that people are being vaccinated in all of those counties today as well. Public health leaders have asked for your patience for this process. And I believe that was Kim Raymond getting her first dose, RN from Candler Hospital. They are following protocols to distribute this vaccine throughout our state. And caregivers like the ones you're seeing here, healthcare workers, are going to be among the first. They're on the front lines of the fight against this virus. We have the populations of our assisted living, long-term care facilities, and their staff members. They're getting priority. And then Dr. Toomey said those over 65 that have underlying health conditions that are particularly susceptible, they will also get priority. Both Governor Brian Kemp and Dr. Toomey mentioning in their remarks before this display here that because the vaccine is here, obviously it's going to take several weeks to roll it out, even months before everyone in the state will have the opportunity to get vaccinated. But they also want to make it clear that everyone still needs to do their part in their individual lives to help slow the spread of COVID-19, because our rates are increasing in the state of Georgia. And that includes some things that they've mentioned for months now, like social distancing, washing your hands, wearing a mask. Okay, our last vaccination of this demonstration will be Tara Manning. She is the resource coordinator at St. Joseph's Hospital in Savannah. And your view may be blocked by one of the nurses. That is either Lisa Lynn or Nancy Toth, the nurses from the Chatham County Health Department. We're administering these doses here today. just like that, our 4 volunteers have received their doses of the Pfizer COVID-19 vaccine here at the Chatham County Health Department on Eisenhower. And that appears to be it. I don't think they are gathering around the podium. If you're just joining us, I'm Ben Singer, live at the Chatham County Health Department, and you have been watching a display of the COVID-19. We had some volunteers from the healthcare field that were willing to take their doses of the COVID vaccine publicly to instill public confidence in the safety of this vaccine.